Aloha, Hawaii. It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Absolutely. And once again, thank you so much for setting aside a few moments of your day and listening to what we have to say from Vein Clinics of Hawaii. Always refer to the website, and I do. I want you to remember this and go look at it later, veinclinicsofhawaii.com. There's a whole lot of stuff going on there. Some of it's really a lot of fun stuff. There's some really fun stuff. We're going to talk about some fun stuff today as it relates to something called compression. I know it sounds formidable. It is formidable. One of the first things that I noticed about the word is that I'm now happy to use it because I'm a happy patient. And I thought that this was relatively something that was rather new in treatment. It goes back to almost prehistoric times, and that's why I'm excited. Dr. Juliff, like me, he loves history. And some of the things that you don't do these things quite the same in your office today than they did back in Hannibal's days, but even BC. But we have been, I think, as humans, sort of wrapping our legs up for a long time. Mm-hmm. Go figure.
Yeah. So sometimes I think we tend to think that all of our modern equipment was just developed over the last 40, 50 years, but no, it hasn't. Yep. It's been a long time in coming.
However, I must disagree with you in a minute, because I can tell you that while a club with a caveman might sort of appear like a baseball bat, the club does not appear like your ultrasound equipment. No. No. I just thought I'd throw that in there.
Yeah. You're referring to the fact that there are cave drawings. Up to 5,000 years ago, that showed soldiers, walking around and had some sort of leg wrap on. Mm-hmm. Now, it wasn't, obviously it wasn't completely clear why those wraps were there. But yeah, there were no ultrasound machines on those cave drawings. No.
But the interesting thing to me, and that would be because if you take a look at history, sometimes these crusades and these marches were, in length, you would be marching for a year.
Yeah. Well, that's true. And venous insufficiency and vein disease was probably no less common back then as it is now. I
got a question, though, because I knew that you were going to say that. And, gang, if you've been listening to the program, this is a condition. This venous condition is something that sneaks up on most of us for decades. And I can tell you specifically that from what I know about history, the lifespan of human beings was a heck of a lot shorter than it is today, which must mean, Doc, that they developed venous insufficiencies at a younger age than this generation does.
Very likely, for not only that reason, but a lot of other reasons, because they were so active on their feet all the time and that kind of thing. But yeah, you're right. Age and time does increase the amount of venous reflux that we see.
Well, you couldn't get on the bus back in those days, right? You either had to get on a beast of burden, or you were the beast.
Yeah, exactly.
Self-propelled. Yeah. One thing before we even get into this, what about shoes? Because obviously, in the very beginning of shoes, the armies of the world and they needed them more than anybody, because they're on forced marches forever.
Right. Yeah, absolutely. Yeah. Talk about, we often talk about professions that are more, a higher risk for developing vein disease, like teachers and nurses. People are on their feet. But ancient armies, they were on their feet a lot.
I got to tell you, and I know that we can talk about this, and there's other ways to do this, both at Doc's office and socially, is when you take a look at women's legs, which we all do, and legs are beautiful things, is when you see some of the footwear, some of the elevated high heels that some of these folks wear. You and I would fall over. You just couldn't do that.
Yeah.
But I'm wondering if that sometimes contributes to circulation issues and things.
Well, wearing high heels all of the time, it does worsen vein function.
It does.
And that's part of the reason for that is that vein function relies a lot on contraction of muscles in our legs. And so, when women walk around on high heels all the time, they're not their ankle isn't going up and down.
Of course,
their calf muscle is not contracting the way it normally does.
However, don't you think that a lot of that was done because there was a look that was expected? Calves are, sometimes there are calf men and there's ear men and eye men and other parts of the body men, right? But I mean, the legs have always been sort of, especially in the old Hollywood days, right, of the musicals and the dancing and everything else. But these people had extremely high heels.
Yeah.
I just as a sidebar, but interestingly enough, some of those historic cave dwellings and drawings, I should say, they probably didn't show the reason why these things were put on, but they actually showed them, which must have meant it was common.
Well, yes and no. Now, back 5,000 years ago in those cave drawings, no, they didn't. I'm sure they weren't, picturing, varicose veins and that kind of thing. However, it was in fairly ancient times when varicose veins were identified and were being treated. For instance, mid 1500 BC. That's a long time ago. Yeah. There's some called the Ebers Papyrus, which was an ancient Egyptian document. And with respect to the history of medicine just in general, people refer to that document quite a bit for a variety of different things. It's the oldest known surgical writing.
Wow. And
in that writing, it does discuss mechanical compression therapy for legs.
Wow.
So, yeah, it's pretty amazing.
No secret that a lot of this happened in ancient days in China and in many places where people just realized legs. I mean, certainly massage.
Yeah,
that must have been day one they figured out about massage.
Sure. Yeah. I think that probably back then they just experienced the fact that, gee, if I put this wrap on my leg feels better.
Yeah.
You're right. Probably in ancient times all over the world, people were finding that and using that technique. But the next time, we've all heard of this guy named Hippocrates.
Yeah, the oath. I'll take the Hippocrates oath. Yeah.
Hippocratic oath. Yeah. He was born 460 BC. And, he was the first to discuss a lot of different, scientific aspects of medicine in general. But in his writings, there are specific details of tight wrap bandages to the legs that were being used for varicose veins.
Wow.
So he identified that connection of, vein disease, varicose veins, and the fact that it's going to be either, at least made to feel better, or, maybe he had this concept that it might be treated also with compression.
I was looking at something the other day, and I thought the next time Doc and I are talking about compression, I was going to ask him this. I saw a story, and they're talking about these massage parlors that have popped up all over the Orient. There are even some here in Honolulu that are just leg massage places. And, and I remember hearing you say before that sometimes that's not really a good idea. I'm talking about deep tissue massage. I mean, the real, like the shiatsu or the hard treatment. Are there conditions that could be made worse by a massage?
Well, the thing that we get concerned about is people with a DVT, deep venous thrombosis, a blood clot. If there is something there like that at that moment, massage, may cause it to break loose and become a problem. But that doesn't, that scenario wouldn't happen all that often. Massage in general for venous and especially lymphatic. We've talked about before people with swelling in the legs. Sometimes it's due to just veins. Sometimes there's more going on.
Sure.
And usually that other thing that's going on is something called lymphedema.
Sure.
And
now that's meaning swelling. Edema is swelling.
Edema is swelling, and lymphedema is swelling that is due to lymphatic problems. The problems with movement of clear fluid through lymphatic channels, lymph nodes, all that sort of thing. And massage is a known therapy component of the general therapy for lymphedema. So
I'm really glad you said that. Let me tell you why. Because I don't want people getting the impression that you or me or anybody is saying that massage is not a good idea, because there's massage and there's massage, right? I mean, there's some that's really nice, pleasant, caressing massage, and there's some that hurt. I mean, somewhere in the middle is probably where we need to be.
Yeah. Well, I've never understood that, the real painful massage. I mean, I've never gone there.
Well, they say that when you release, when it's incredibly sore and you put that big pressure on it, when you release, it feels really good.
Yeah,
my thought was, well, if you can feel before the compression, okay, let's just not do that.
Yeah, exactly.
But in many respects, because we're talking about compression today, isn't that in many respects some sort of massage? It's pressing you in.
In a sense, it is. In a sense, it definitely is. Getting back to Hippocrates, he was a smart guy because he was actually the first to connect venous disease with ulcerations of the legs.
Mm-hmm. Okay.
So, I mean, that was a huge, conceptual leap there. We've talked about venous ulceration, or something that we call venous stasis ulcers. Ulceration of the lower lower leg, especially down around the ankle, and the mid calf. Most of the time when people have those that ulcers in that location, most of the time it's due to venous insufficiency. Now, again, Hippocrates didn't have an ultrasound machine. But he was able to connect those two things. And again, this was, 400 years BC.
Well, if we just went back 50 years, I know that there's a lot of people in the audience whose older siblings or whose parents or grandparents had pretty invasive treatments done to varicose veins. And that, from what I understand, and being in your modern office, of course, I've really had my eyes open, but it doesn't seem like any of the, quote, tools of the trade that were used before are being used as much now because of technology. Not just the ultrasound, but everything you do in treatment.
Right. With respect to the treatment, I mean, over the last 50 years, things have changed tremendously. But, ultrasound, just looking at ultrasound itself, that when it came on the scene, now that's been around for, a good number of years, 30, 40 years, but, that's being improved all the time. But that changed, 25 years ago. It revolutionized the way that we look at, especially vascular problems, and even more, especially with respect to venous disease. The ultrasound just does it so easily compared to the other things that we had to do to diagnose it before.
I'm never into, woo-woo-woo seances and that kind of things, but I just thought, wouldn't it be neat to be able to have a seance and bring Hippocrates up today and say, hey, listen, thank you for all you did, but look what we've got. I mean, wouldn't somebody like that be a kid in the candy shop? Just imagine.
Oh, yeah. Somebody of that intelligence level would just go crazy seeing what we have today, sure.
At one point in time, because I know you have some more really interesting history stuff, but William Harvey, I need to talk about that. But at what point in time did it become obvious to practitioners that we need to have some people that know more than just a regular doctor about this? And this is a field that is just begging for people to enter it because it's necessary.
Yeah. It was, mid-1900s, mid-1950, early 60s, that I think that, the subspecialty, kind of, trend started. Because, before that, before that, the just the volume of knowledge that was out there was nowhere near as what it is today, and not only from a knowledge standpoint, but also an experience standpoint. As the technology becomes more complicated, the experience of physicians using that technology becomes even more important.
You remember that generation you're talking about, whether you want to call it the greatest generation or whatever, are the ones that had the dramatic market difference in length of time on the planet than their predecessors. And we kept with that number going up until now, where it looks like it's leveling off. And this generation that's just being born today may not significantly outlived the current one. In other words, do you think that it was the need of more and more people getting the disease as we got older that prompted more people wanting to get into it, specialize in it, like you?
Yeah. The need is there, but as I think the recognition of different diseases has improved tremendously. And once you recognize the problem, then you can start to work on fixing it. And I think that's been a big reason why we've just the length of life has increased.
So give me some more of your the ones that you admire the most, spinning way back on the wheel.
Well, there was this guy named William Harvey who, is a particular favorite of mine. He was, one of the early, very famous surgeons, and he lived in the 1600s. And wrote about how compression can benefit venous disease. So again, very early on, he was making a connection between those two things. And he developed different ways to apply compression.
Yeah, see, I was going to ask about that because right now, and those of you that are listening, when you go onto the website, veinclinicsofhawaii.com, you'll see Dr. Juliff, some of the things he specializes in. And when this comes up, this stuff about compression and other things comes up, it makes you think, okay, if they did it back in the day, now I know that we have better than ACE bandages, right? We got the Velcro closing things. We got there's that airbag that you can put on somebody's leg to compress it. They didn't have any of that stuff.
No.
So how did they accomplish the compression?
Yeah. I don't know.
Yeah. I mean, just how they have been with fabric or with cloth. Maybe some things didn't stretch as much as others.
Right. Yeah. Right. Yeah. I mean, I think that there must have been kind of cloth wrap type apparatuses, but. So the modern era of stockings, if we look at, for instance, the 20th century, we got here in the United States, actually, we got a later start than most.
That's interesting because, like you said before, Germany, way up in front of us on that one, right?
Yeah. The European countries, Western European countries in particular, they were very, very early getting into understanding venous disease and trying to start to develop treatment forms for it. And, very early in the 20th century, they started getting a little bit more, motivated to treat people with compression and identify that as a, important feature.
A friend of mine the other day, and I was dying to tell you this one. I said, I was listening to the Vein Show with you in the doc, and I do that all the time. I elevate my legs all the time, and I wrap them up with an ACE bandage, and boy, I'm just self-treating myself. And I thought, okay, this is good. This is probably good because you're doing something. And I used to think that an ACE bandage was a pretty good thing myself. But by the very nature, 5 minutes after you put them on, they're not as tight as they were, huh?
Yeah.
Because they stretch.
Right. Well, they it wasn't as controlled of a garment as we have today. That's we'll get into that here in a minute. But ACE bandages. We've all used them. That's for sure. But they don't last very long because of the elasticity is lost quickly, and also they're hard to keep on. Yeah. They invariably fall off.
You got to silly little clips.
Yeah.
Do something with them. Not anymore. Wait till you hear about some of the new stuff.
Yeah. So, so in this country, finally around 1950, that's when we started getting on the bandwagon with respect to, getting a little more scientific about compression stockings, because they really have gotten to become a very specific, mechanical construction to bring about the, benefits that they do. But there was this guy named Conrad Jobst.
Yeah, I know that name even till today.
Yeah. And Jobst stockings, were very, very common. Now over the last 20 years, there have been a whole slew of companies getting into the development of compression stockings, but Jobst was one of the first ones. And, I can remember, back in the older days, everybody who came into the hospital had those white Jobst stockings.
Sure, yeah. And you still see them. I mean, I still see them around now, now that I know what they are. But I got a question about that. And that is that, obviously this was a great step in the right direction. But everybody that I've talked to, and over the last several years of being affiliated with the venous, profession, and that is that, wow, they're so expensive. And I keep telling people, because I had to learn that myself, because I thought, holy smokes, these things cost like a fine dinner. Well, you have to sort of differentiate between what it is. So I don't call them stockings anymore. I call them my I got to go put on my device. Yeah. Because I don't want to say I'm a penny pincher, but I kind of am, I don't want to pop, big money for a pair of socks. Yeah. But then you got to say, well, guess what, Mike? These aren't a pair of socks.
Yeah.
It's a garment.
You're right. Yeah. They can be a little pricey. I mean, there's no question about that. I'm right with you there. Yeah. But you have to appreciate what they are. Yeah. They're not just a pair of socks. They're manufactured in a very specific way. And you have to understand what they're doing for you. I mean, you got to keep in mind the beneficial effect that you're getting from these things.
That being said, and I know in a perfect world, in your world, everybody'd wear them. Just even if sick or not, wear these things. They're good for you. What I have noticed, and maybe you can comment to this, I've noticed more and more often lately that there's a tremendous number of people that are wearing these things athletically. Yeah. And I mean to say that they certainly have no varicose veins. They're at the top of their shape. I mean, maybe some of them do, but they're wearing them because of circulation. And they think the more circulation you have, the better your output is. Is that true?
The reason there has been a trend for people in athletics, scenarios to be wearing compression, especially compression. We call them sleeves.
Yeah. Exactly.
Compression on the lower leg,
ankle to the knee or something.
Yeah,
right?
exactly. Yeah. And there was some scientific evidence, a number of years ago. Not too long ago, that showed that actually that there was a benefit for muscle recovery.
Mm-hmm. Blood, right?
Well, yeah, but it goes a little bit beyond that. When our muscles are working, the muscles are processing energy, and there's a waste, molecular waste from that that gets built up in the muscle. And they found that when people were wearing compression on the calf muscle, those muscles were able to clear.
I was going to say recover, right?
Recover, it's recovery. Mm-hmm. So it's not really improving, the blood flow down. Certainly, it will facilitate and improve venous return. But more importantly, it has to do with muscular recovery. But that's sort of a trend these days.
And I look at that. If you take your significant other to a nice lunch, or say even a nice dinner, once a month less, that you can have a couple of these garments in your collection with no trouble. Explain though, you said that, it took special design thing, Jopes and some of the others. What is it that they needed to do to have the compression vary on different parts of the foot or leg? Because it's not just one constant pressure from toe to knee, is it?
Yeah. And that's what this guy, Conrad Jobst, did. He was a mechanical engineer. Mm-hmm. He was a guy from Germany. And apparently he also had venous disease. Okay. So he had that, aspect to his, history that kind of motivated him, I'm sure. But the stockings are elastic. And the stockings exert a certain amount of pressure or compression on the leg. And the pressure is measured in millimeters of mercury, the same way that we measure blood pressure. Mm-hmm. And the greatest amount of pressure that is exerted by this garment is at, the lowest level of your leg.
So that's where you need the most compression.
That's where you need,
Gotcha.
And we call them graduated compression. Because the highest is down around the ankle and foot, and then as you go up the leg, the amount of compression decreases.
What's interesting to me is, and I've seen some of the materials in your office and doing my own research and buying the ones that I have, is that it shows you that. Now, when you just take a look at this garment, it's all one color. Yeah. It doesn't look like there's a lot of things going on, but there are.
There are.
It's amazing.
And that's why I think you referring to it as a device is very, very appropriate.
I need to do that because first of all, I need some new ones.
Yeah.
And I have this thing, I don't want to get rid of the old ones, but there's actually a point at which you're kidding yourself, right? If they get all these runs and tears in them, they're not doing the job anymore.
Yeah. And you know, the elasticity is not, it wears out after a while, and you do have to replace the stockings. But the other thing about that is that they last a fair amount of time. Typically people can wear their stockings for 4 to 6 months and still feel like they've got an adequate amount of compression. Mm-hmm. So it's called graduated compression, highest at the foot, and lowest up higher. And in the theory there is that it's because of that pressure gradient, it's facilitating blood flow up. And that's what's happening.
Okay, let me give you out there in Radio Land the 100% Mike Buck endorsement. Because I was as skeptical as anybody about these things in the first place. Only because, first of all, there's a technique to putting them on. It's not easy to get them on sometimes. But, once you do it and you make it regular, I can actually tell the difference in the circumference of my ankles when I don't wear them and when I do wear them.
Oh, yeah.
And that doesn't mean, I actually understand that there's certain things that we do to our bodies that you never recover from. And certainly I'm going to always have these issues with my legs, not because I'm not eating the right stuff or exercising anymore. That's not right. But it's just because once you've done the damage, you have to continue to manage it. Yeah. And that's exactly what I think these things do.
That's exactly right. Yeah. Compression stockings are so much a part of the, long-term treatment and management of, venous insufficiency. Like we've talked about a lot, and that is that, venous disease is genetic. We inherit it. It's not like we had a bad diet, or it's not like we, were eating the wrong things or taking the wrong medication. It's kind of genetically predetermined, and it's something that, most people have to deal with for their entire life.
Yeah. And, I think that's a lot of things. I know that I was talking to a dentist friend not too long ago, and older folks should actually be going to the dentist more often rather than less often. But in actual fact, what happens is after your 2 times a year school checkups when you're a little kid, then maybe once a year or every 2 years, and then pretty soon only when there's an issue.
Yeah.
And isn't that true that a lot of people come back to you that went out and just struck out on their own and says, I'm done, I don't need, and then 2 years later, whoops, I got to go see Doc again.
Yeah. Yeah, we see that all the time. We encourage people to come back like your dentist every year or so to get an ultrasound, get a little bit of a venous checkup. But invariably, many people don't.
Well, what about this? Look, you've heard. I know. Look, first of all, you can't kid a kidder. A doctor, Juliff, and anybody in his profession or almost any medical profession, just by looking at a patient, you can make a pretty good not just diagnosis, but think this guy's not been wearing. I don't care what he tells me. Yeah, he has not been wearing his stockings.
Well, we hear that all the time.
Oh, of course.
Yeah, we ask them, and say most of them. Oh, yeah, every day I'm wearing my stockings, but just looking at them.
But when they come back into the fold, Doc, like me, it does make a difference.
Oh, yeah.
And let's say you go a week without wearing them. Guess what? One thing I noticed, one of my shoes didn't fit me as well. And I'm thinking, my foot must be swollen.
Yeah.
Well, it was.
Yeah.
The slip-on wasn't a slip-on anymore. So 2 days of wearing my compression socks, putting my thing, boom, it floated right on my foot.
Right.
So that tells you something, doesn't it?
Oh, yeah. Yeah.
And what is it that makes it different?
They really do work.
Yeah, they do.
Yeah.
What is it that is important when you take measurements of your patient's legs? Noticing the difference. No 2 legs are the same, right?
Yeah, no 2 legs are the same, and measurements are important. Again, in this type of device, because it is a device, not just a garment. And the other thing is that if you're serious about wearing decent compression stockings, you have to make sure that they're something that we call medical grade.
Okay.
And
if it says that on the tag, do you know it to be true?
Well, I don't know that most of them say medical grade, but you have to, I think, learn from either a friend or a physician. what would be considered medical grade and what are not. Often the medical grade compression requires you to have a prescription.
Mm-hmm.
So if you can just go into, Walmart or whatever and buy tight stockings, that's fine. If that's all you need or all you want, that's fine. But it's that these are not the stockings we're talking about.
You've got a couple of converts that listen to the show that told me that they heard us talking about travel, and they always now they get them. They're store-boughts. But they make them feel better, and they say that not only does it make you feel better, but it really does make you feel better.
Oh yeah,
it's not just perceived; it does.
No, right.
So those are what you said is that's better than nothing. But look, if you're in for a penny, you might as well be in for a pound. You might as well get the right stuff.
Yeah. And even the non-medical grade stocking support hose or compression type device stockings, they're a little more expensive than just your run-of-the-mill gym socks.
Oh yeah,
anyway,
of course.
So
okay, so anyway, that is the lead up to the lead up to these garments being constructed, and now you say there are several, and I know that you at the vein clinics of Hawaii you carry them, and
yes.
it's by the way, let me give a little plug for Dr. Jula's staff there. They go out of their way to make sure the right thing happens for the right reason, and that means that if you go in to one of the offices, Maui, Kauai, Big Island here on Oahu, or go to veinclinicsofhawaii.com online, you're going to get somebody that's going to help you do into that. It's good to go out on your own and do it, but every now and again it's like you don't want to do your taxes all by yourself every time. Every now and again it's good to have a tax guy. When you look into this, am I getting the deductions that I need? Am I taking the right medicine? Am I wearing the right socks?
Yeah. And there's a little bit of an art to it. I mean, everybody's legs are a little different, that's for sure. And we try to we measure legs and we get them into a specific size. But there's some nuances. I mean, there's some brands that are better for this type of form, and some brands that are better than that type of form. And my staff has become very familiar with kind of weeding those things out, and they'll give you a good suggestion as far as what brand of stocking you should wear.
I got this one, and I've seen this happen before to me. Most of the time, the socks that I'm talking about, those of you that already have the leg wraps and other things, they're a little bit different. And I do know that some of these stockings or some of these devices have a hole for the toes. They're just half your foot and up your leg. I've noticed that every now and again, if one gets rolled over for whatever the reason, maybe it's behind your knee, it can be painful, and it leaves. You don't even notice until sometimes when you're taking them off. Say, what's that groove? What is that? And is it dangerous?
A lot of people have that problem. Mm-hmm. And I think the way that you handle that is just to kind of, manipulate the way the stocking is fitting on you to put it into a comfortable sort of, fashion. Now, a lot of people will say, "Oh, this thing is so tight; it's cutting off my circulation."
Yeah.
And and I tell them, "No, it's not. It is tight. I'm sure you feel that it's tight, and it can be a little uncomfortable, but it is not cutting off your circulation."
I saw an ad on television that is not unlike some of the pictures at the vein clinics of Hawaii. And that was what happens to a guy that has these socks on all day, and halfway up his calf, it's too tight, and there's actually a groove in there.
Yeah.
Is that a concern?
Well, yeah, because you don't want that to happen. But is it going to create any permanent damage? No. Yeah. And probably what's happening there is that the upper band of the stocking has come down mid calf, and probably the reason that it looks like it's digging in so much is because there's swelling above the stocking.
Oh, now. I didn't think of that. There you go.
Yeah. So, and that's why it's important to have the stocking up as close to the knee as possible. But yeah, you're right. Right behind the knee is often a problematic site.
And I'm guessing that's why that there might be some people, and even though, gang, most of the time, and I've asked this of Dr. Julep before, and maybe even on this show before, I can't remember, but I can tell you that there's the perfect size for everybody. And you can get them if you need them to be custom ordered. I guess you can do that too. But that would be the call that usually the doc would make, right? Saying that, these store-boughts aren't good enough for you because maybe your calf's too short or shorter than it should be, or longer than it should be.
Yeah, or my staff. Again, they're very knowledgeable about all of that and can give people recommendations. But so why compression stockings?
Yeah, exactly.
Why? So that goes to the the underlying root problem with venous insufficiency. And, basically venous insufficiency, the veins in our legs aren't working properly. And usually that's due to a valve failure. Mm-hmm. There are one-way valves within the veins that keep the blood moving upward. That's the right direction. And the propensity for those valves to fail is what we inherit. That's the genetic component of venous insufficiency. So if our parents had varicose veins, we're probably going to have them. And the reason that happens is because those valves fail. So the valves fail and the blood starts to settle downward into the leg. And that's what leads to something that we call pooling.
I was going to say, It's gravity.
Yeah,
right? It goes down to the bottom and doesn't have a way to get up.
Exactly. Yeah, gravity is pulling the blood down. And when the valves are functioning, they're strong enough to counteract that pull from gravity. But if there are no valves, then it's going to go down.
Is that why the pressure at the bottom is greater, because it needs to squeeze, to compress, to maybe squirt that blood uphill?
That's the concept. So the pooling that happens in the lower leg then creates the symptoms that we see: the achiness, heaviness, fatigue, and swelling. As fluid is leaking out of the vascular system and into the soft tissue of the leg, we get swelling. That's really what the swelling is all about. And then in that fluid that's kind of leaking out of the vascular system, that then leads to chronic inflammation and molecules that harm the skin, and the skin gets dark, and then leads ultimately to ulceration.
All of which could have been solved, if you'd have been conscious of this before.
Sure.
But here's another one, and I think this is kind of important because you get this feeling of relief when you see that something's happened and that something feels a little bit better for whatever the reason. And once you've crossed that bridge of this compression being a good thing, what about too much? I mean, sometimes people say, I have a headache, I'm taking a so-and-so. It's a bad headache, I'm taking a couple so-and-sos. Are there some people that think, if this is good, let's have more of it? And can too much be bad? You couldn't tolerate it, could you?
Yeah, well, yes and no. Mm-hmm. Is there a situation where too much compression from a compression-type garment is too much for an individual patient? Yes. Mm-hmm. And that is mainly in the setting of a patient that has venous disease but also has arterial disease.
Okay. Yeah.
In the arterial blood flow is blood that's going down. So that's something that we look at. I mean, every patient that comes in, we examine their arterial system. We check pulses, and if there's a question, we do an ultrasound to look at that. But yeah, there's a certain level of arterial occlusive disease that if you have more than that needs to be corrected before you embark on compression and venous intervention. So the answer to your question is yes. Now, it's not of the manufactured type of stockings and the level of compression that there is out there. Could it be harmful for other people that are not in that category? No, in general.
Yeah. As a matter of fact, they would be, I would imagine, to some uncomfortable. What am I doing this for? But yet, I do know that once you use this, once you have that tool, that's why I was so interested in finding out what you said historically, how it happened that these things even got developed. And one wants to say, okay, well, what's next? Well, it looks like in that particular area, it's where it needs to be. I mean, how different could it be?
I think the changes that are going on right now are just these manufacturers developing probably more comfortable fabric and just constructing the stocking. They're maintaining the integrity of the graduated compression, system, but they're making it more comfortable for patients and trying to find other ways to do it so that people don't have problems.
I've never asked this question, and I think it's kind of important. There are some people that are, say, latex intolerant, and you find that out right away, and that's why there's so many different kinds of bandages and Band-Aids today, because I guess it's a bigger thing than people used to think it was. Are there any, what are these things made of? I mean, I know it's probably a secret, but what are these compression garments made from?
Specifically the fabric, I can't tell you.
Yeah,
Exactly
I'm certain it's an engineered fabric.
Yeah.
That it's not cotton that got spun off the loom by grandma. That there's something miraculous going in there chemically.
Yeah. I wish I could tell you.
Has
exactly
anybody
what's
ever
going on.
reacted poorly? Have had
some people will. Very, very occasionally we get a reaction that we think might be an allergic reaction.
Yeah.
Some people's skin is just more delicate than others. And the thigh-high stocking that we use has a rubberish kind of upper band that helps in keeping that stocking up. And some people will sort of react to that in an inflammatory sort of way, but again, I don't think it's an allergic reaction. It's just them reacting to the abrasiveness, maybe of that upper band. But rarely do we see allergy. Most of these stockings do not have latex.
There you go. Now here's another one. I remember in previous programs that you telling me that sometimes insurance companies like it and doctors like it when somebody wears compression garments for a period of time before they get treatment. And you said that sometimes, and maybe you could explain why this is, it's harder to treat patients that have a lot of swelling. And if you could handle some of the swelling, isn't your job there on their veins, I don't want to say easier, but simply easier?
That is true.
Yeah.
That is true. Some people might come in with a tremendous amount of swelling, and it's really swelling to the point where we can't evaluate them fully or adequately, again, with the ultrasound, because all that, excess fluid in their leg gets in the way of us being able to see what we need to see. When people come in with a lot of swelling, we have to control that in some way. And often it's just with compression stockings. Sometimes it's with other things that we do. Controlling the swelling benefits us evaluating the patient and ultimately treating them. There's no question about it.
And gang, one of the things that I must tell you, and I say this, in a joking way, but because Doc knows that I really am trying, and I do wear my compression stockings a lot. But even more so, if I were going in for an examination, and maybe you can explain why, if you've got a leg that is 2 or 3 inches bigger around than it should be because it's swollen, that as good as the equipment is, it's kind of hard to get through all of that stuff.
Yeah. Because, for a number of reasons. Number one, just all of that fluid interferes with your ability to, visualize what you need to, but also all of that fluid can be compressing the veins just by virtue of being there and can interfere with our ability to diagnose reflux.
Incidentally, when you do have the ultrasound, which I'm always fascinated by, matter of fact, I'm getting another one pretty soon and we'll talk about it on the show. It makes these squishy sounding noises. Yeah. And I'm thinking that's what's going on in there. Is it the machine that's making it something that you can hear, or can you really hear it?
It's
you know what I'm getting at?
Yeah, if you put your ear down under your leg, you can actually hear it. No, it's the machine that's generating that sound.
But I think it is really helpful to look at it, because I do know that. And here's another thing: Dr. Juliff keeps meticulous records of every patient, and this is really important because some people don't come in for the shave and haircut maintenance often enough. So you might say, you haven't been here for 5 years. This is what we did for you. Here's your ultrasound. Now you do a new ultrasound. Guess what? You've changed a lot.
Oh, yeah.
Yeah, that happens all the time, doesn't it?
Sure. Yeah, definitely. So, what do the compression stockings really do for us? There's a number of different things that, on a functional standpoint is beneficial. The first one is that it helps venous return. So it's benefiting the ability of your leg or of your veins in your legs to propel blood upward. One of the things that it's doing is that it's counteracting the dilatation of the veins that are in your legs.
Don't slip that by me. You're slipping one of them words by me. Dilatation.
Dilating, because that's part of the process. We talked about the valves failing, and typically the valves fail because the vein itself, the wall of the vein, is starting to dilate. It's starting to get bigger, and so that's part of the process. So the stockings, one of the things that they do is that they kind of maintain normal size and construction of the vein, so that the valves are a little more effective, even though they might be dilated and not functioning very well in general. So that's one of the things that it does. Another thing that it does is that it decreases venous pressure.
Okay, so I get that. I really believe that.
Yeah. So in one of the problems that we see, one of the pathologic processes that is going on is that as valves fail, as blood is being pulled down by gravity, it's increasing the pressure in the entire venous system. And that is leading to, the domino effect of all these bad steps taken.
You heard the word leak come up a lot in that, right?
Yeah.
This is leaking, that is leaking.
Right.
You know what happens when the air leaks out of your car tire?
Yeah.
Your tire goes flat. Well, I'm guessing that because of that, is that, I don't know if it's still the same. Do some insurance companies actually want to make sure that a patient has done this before surgery?
Yeah. Getting back to your point from before. That's the typical routine. Is that compression stockings? It's such a mainstay of part of the treatment of venous insufficiency, such that. The insurance companies want us to treat people they want us to treat people conservatively.
Yeah.
And, compression stockings is the mainstay to conservative therapy for venous insufficiency. And most insurance companies want us to treat people for some period of time, usually that's 60 to 90 days, with compression stockings and conservative therapies before they allow us to go ahead and do the procedural things.
I must tell you, as a patient, and I had that happen, I was sort of resentful. I wanted the treatment now that we know it's gone. But I do get it, and I'm guessing is it because maybe the physician's ability or potentially is going to be able to get more effective treatment when there's not all of that swelling in the way.
Do I think that is the insurance company's goal?
Is it?
No.
Yeah.
Unfortunately.
Then why do they care?
Well, maybe
they don't.
They're trying. Well, yeah. I don't know. I don't want to be too ugly about my comments, but I think they're just they're making sure that there isn't a less expensive way to treat a patient.
Of course. Yeah.
There might be a few patients out there who we give them compression stockings. They wear them for 3 months, and they go, "Oh, well, I'm fine."
Yeah, the pain's gone.
Yeah,
swelling's gone.
And I don't mind wearing these uncomfortable stockings every day of my life for the rest of my life, which is that's the crux of it. To adequately treat people with venous insufficiency with stocking therapy alone, they really have to wear it during all waking hours for every day of the rest of their life.
Now, how important is it to know, for you, the physician, or the insurance company, to know that Mike was wearing these stockings for 2 weeks prior to this ultrasound? So if he weren't wearing that, and there was all of that swelling, how different would the ultrasound likely to be?
Well, the ultrasound itself would be maybe altered quite a bit. The result, and that that's our reason to use compression stockings and other things to get rid of the swelling is for us to be able to get a good ultrasound. We need a good diagnostic ultrasound. The insurance company doesn't get involved in that step. They don't say, "Gee, you got to have this patient in stockings for a month before you can do an ultrasound." They don't get involved in that. They just get involved in telling us when it's appropriate to move on to the procedural type things that we have for therapy.
The other question that begs to answer every now and again, and I hope we have can spend a minute answering that, is that a patient needs to put their skin in the game. They really need to be proactive like I've learned how to be. And that means that you need to do all of these things, because if you don't, then you're lessening your chance of getting the relief that you're looking for. And therefore, I think more encouraging, I tried that, it didn't work.
Yeah.
Waste time.
Well, they're going to get a better immediate result. And then in addition, they're going to have a better long-term result too, because, people with venous insufficiency, often not often, all of the time, they're going to benefit from some usage of compression stockings, probably for the rest of their life. Now, we can back off quite a bit with respect to the amount of compression, and we usually go from a thigh high to a knee high. But, people with underlying venous insufficiency, like yourself, benefit from, getting into the routine of wearing, what can be a relatively comfortable day in and day out use of a compression stocking.
Yeah, and I've noticed something else, and maybe just a quick question. I hate this being about me, but I do know that every question I ask about me, that there's hundreds, if not thousands, of you all out there, experiencing the same thing, but you don't have a doctor sitting across your table you can talk to about it. That's why you got to go to veinclinicsofhawaii.com to make that appointment and get yourself diagnosed. Sometimes I'll go weeks feeling pretty good. And then it's a Friday. I take off my compression stockings and I go fishing, or I go fooling around during the weekend, and I'm not wearing my stockings. And then Monday, my back's a little bit sore. I don't think I can put my stockings. I'll wear my slippers today. Then before you know it, you've undone weeks of being a good guy by being a bad guy. Yeah. And I know this is Hawaii Doc. How do you convince people by saying, you know what, you just really need to do this? It's not an option. You really need to do it.
That is why it's so difficult to get people to do that, 60 or 90 day required time period of using stockings that, the insurance companies have instituted. And most people are not going to. Again, this is Hawaii. And, we treat a lot of, some fairly young and active people, and, they're just not going to wear the stockings. Yeah. But
no matter how fashionable you color them.
Yeah.
But wait a minute, there's another thing. And that means that people on the mainland, I spent a lot of time, as you know, in Alaska, everybody wore them. Because you couldn't see them anyway. They had 40 pounds of mucklucks on and all this other stuff.
Yeah.
But it seemed that they were healthy.
Yeah.
And even though everybody's got sick and got colds, I never saw anywhere near the same amount of leg fatigue.
Oh,
it's
that's
pretty
interesting.
But just to make people really get that, and I know this probably comes up, and let's spend 1 minute doing this too. I have maybe 7 or 8 pairs of compression stockings. I'm thinking that what people really need to do is get a bank of them going so that they're not washing them as often. I try to wash them at least every other time, if not every time I use them. But they take care too. You got to pay attention to those washing instructions, and you certainly don't want to put them in a dryer.
No, it's not recommended.
So how many pairs do I need?
Well, that depends on how often you want to wash them, but I think, if you have, 6, 7, 8 pair of stockings, that's gonna be a pretty good thing, because, I don't think you need to, the stockings are such that unless you're out getting them dirty or whatever, you don't necessarily need to wash them every time. No.
Yeah, and by the way, gang, it used to be, well, would you like the fashionable black ones or the fashionable black ones? And now they're brown. I've got tan ones. You get these colored, the ones that are colored. Some of them are getting pretty nice. And I guess that's because that's a way to reward the good guys and gals that are wearing.
Yeah, and like I said, there are a whole host of stocking manufacturers out there now, and they're competing with each other to make stockings that are more appealing, more comfortable. Making them look less like compression stockings and just, either a sports sock or a dress sock or whatever you want.
Yeah, and that is so important. And I want to make sure that we don't overplay the expense of them, because it can be a game changer. But once you get past it like I did, you realize, you know what? This is a luxury I'm going to afford myself. I can afford one less dinner or lunch a month by always having a new pair of stockings on, and getting a professional like Dr. Julius himself or his gang to make that measurement is certainly the best way to do it. And so if you'd like to know more about this or anything else that Doc and I have talked about, please go to veinclinicshawaii.com. VeinClinicsHawaii.com. And if there's something that you'd like to hear on the program, something you like covered, there's also a way to contact us and everything else right there on the website. So it's worth your time, and it's worth your time on Maui, on the Big Island, on Kauai, and certainly here on Oahu, to go to VeinClinicsHawaii.com. And we'll see you next time. In the meantime, get those socks on and wear them all the time. Be good. You know, it's easy for me to say because now I do.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, VeinClinicsOfHawaii.com. That's VeinClinicsOfHawaii.com.